In the case of Rufus Humphrey, Dr. Mell evaluates his gross and microscopic anatomy. Out of her initial findings, the one where she looks at the histopathological features of the cheek scrapings from Rufus's rash is microscopic. Gross anatomy was used to make all these other observations, including the enlarged spleen. When comparing gross versus microscopic anatomy, there are three components. The scale of study refers to the level or size at which a particular subject is being examined. Gross anatomy involves studying structures with just your eyes. Techniques used to study gross anatomy include things like cadaver dissection, medical imaging, and surface examination. Microscopic techniques often involve histology, the study of tissue sections under the microscope, and cytology, the study of individual cells. In terms of applications, gross anatomy is useful in clinical diagnosis, surgical planning, and understanding the relationships between organs, whereas microscopic anatomy is important for understanding disease at the cellular level, diagnosing conditions through biopsy, and researching how tissues function and repair. Both are fundamental to the understanding of anatomy, each providing unique insights into how the body is structured and functions. In addition to gross versus microscopic evaluation, there are two distinct approaches to studying anatomy: regional and systemic. A regional approach focuses on specific regions of the body and examines all the structures in that region together. When Dr. Mell was examining Rufus, she was using a regional approach. Remember how she was observing all the external findings on the head before moving to the internal organs in the chest and abdomen? A systemic approach examines each body system individually across regions. Dr. Mell relied on her knowledge of the immune system and how the autoimmune disease lupus can affect different parts of the body. Without this type of approach, how would she ever connect the histopathological findings from the rash on Rufus's cheeks to his enlarged spleen? Both approaches are useful and necessary. A regional approach provides a practical method for evaluating a patient. However, an understanding of each system is important for making the correct diagnosis.